Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. It is Wednesday, meaning we'll bring you an address from the Peterborough Public Health Unit and Peterborough's Medical Officer of Health, Dr. Rosanna Salvaterra. Here's her update from earlier today on the COVID-19 situation in the area.
So I'll use the weekly dashboard, which is up for those of you in the room. We have on the screen. For those of you who are joining us by telephone, it has been posted. You'll see that our current case count as of 4 p.m. yesterday is 76 cases in total. This represented an increase of 3 cases since last week. These 3 new cases are all related to one family member who recently has returned from travel. With 69 resolved cases, that means there are only 5 active cases being followed by public health right now. We remain at 2 deaths, and we have almost 7,000 local residents who've been tested. We're at about 6,900 tests, which works out to be 1 in every 21 residents in Peterborough has been tested for COVID, or 4.7%. The source of exposure, if I can go to the next slide, please, Brittany. You'll see there on the top right, over half, 51% of our cases are close contacts of an existing or a confirmed case. We still have 31, almost 32% of our cases being linked to travel, and 17% of our cases have no link to either travel or an exposure, and they represent transmission in the community. Our rate at 17% is just under half of the provincial rate now of 35%. As far as outbreaks, we have no new outbreaks to report. Since last Wednesday, the outbreak at Kawartha Heights Retirement Home is the only ongoing outbreak. I am pleased to report that the outbreak at St. Joseph's at Fleming's is now resolved. If we go to the next one, this is our timeline of our cases by reporting date. So if you look at that last week, you can see that we have days where we don't have any new cases being reported. Our incidence rate over the last week was just about 1.4 per 100,000. And if we go to the next, there's our cumulative cases by onset date. And again, you'll see that the curve is nice and flat, not quite flat, but it's certainly flattening out as we go further along. And the next map shows our cumulative cases. So you'll see Peterborough there. Our rate is sitting at 51.4 per 100,000, which is notably less than the provincial rate of 159 or 160 almost per 100,000. Okay, I think that's it for slides. So the case, any new public health measures, just to let you know, the case definition has been revised. So now any travel, either within Canada or outside of Canada, is considered as a risk factor for COVID-19 acquisition. Ontario has extended its various emergency measures to May 29th with some exceptions. So we are, as you heard from our board chair, we are now in phase 1 of our recovery. And we learned yesterday that schools will remain closed until September. So I'd like to take just a few minutes to talk about testing. In the provincial framework for recovery, access to testing is one of the 4 pillars. Last week, I spoke about how testing is a look in the rearview mirror. It takes about 2 weeks or more for someone to be infected, for the virus to incubate, to develop symptoms, to get tested, and then get results. For this reason, we have to build in enough time in each phase of the recovery for that story to be told. And that means waiting 4 to 6 weeks before we can know with certainty whether we can continue to roll out or whether we actually need to roll back up with our public health measures. So testing is critical, but for the results to be timely, we need everyone to know the signs and symptoms of COVID-19 and to access testing as soon as those develop. So who should be tested? Really, it's anyone with symptoms, but especially for people who are working with the public and are at higher risk of exposure, it's important that they self-monitor on a daily basis for the development of any of the symptoms. And at the first sign of illness, they need to isolate at home and not go to work. Which symptoms? There's actually quite a long list now. An easy way to sort through them is to do an online assessment and to use the online tool, which can be accessed from our website by clicking on the question, "Do I have COVID?" The tool was just updated yesterday, and it will direct you on what to do, and you can now request a callback if you have any questions about the tool. If the tool directs you to be tested, you'll want to call the PRHC Assessment Center at 705-876-5086 to make an appointment. This line is open every day from 8 to 8, or you can call your family doctor or your nurse practitioner if you aren't sure, or if you have other health concerns you wish to discuss. Your primary care provider can call on the Peterborough paramedics to come and test you in your home if needed. It's important to diagnose COVID early to stop the spread of the virus. Anyone who is waiting for a test or for test results should be self-isolating just to make sure others aren't infected in the meantime. And if you're going for a test, please wear a mask to protect others. Some people are asking to be tested even though they don't have symptoms. They're anxious and they're looking to be reassured. We do not recommend testing for COVID if you do not have symptoms, but there are some exceptions. If you are a close case of a contact and you live or work with vulnerable people, you may be advised to get tested. In fact, in long-term care settings or in group homes, we are testing the roommates and the asymptomatic contacts of anyone being tested for COVID at the same time. We're not even waiting for results. So you can count on the advice of a public health nurse in circumstances where you may have been exposed and may not be symptomatic yet. But it is not a decision that we expect you to make on your own. For helpful advice on testing, you can always call Peterborough Public Health to reach a public health nurse Monday to Saturdays, 8:30 to 4:30 by calling us at 705-743-1000. The online tool is on our website 24 hours a day if you have internet access, and if you don't, it is after hours. You can leave us a message if it's not urgent, or you can call telehealth. As this first wave of COVID continues to recede in Peterborough, we must not forget that a century ago, during the Spanish influenza pandemic, it was actually the second wave that was the most deadly. No one can predict the trajectory of this COVID pandemic. Until we make it to the other side, perhaps in 18 or 24 months, we need to incorporate fast and easy access to testing as part of our reflex reaction to the development of any new or worsening symptom that can signal a COVID infection. Thank you.
Dr. Salvatierra presented the COVID-19 statistics for Peterborough City and County in Hiawatha and Curve Lake First Nations. Now for the city of Kawartha Lakes, who are up 2 cases since yesterday. There are currently 145 confirmed cases in the city of Kawartha Lakes, 30 current high-risk contacts, 9 hospitalizations. 118 out of the 145 confirmed have been resolved. 32 confirmed deaths as part of 3 confirmed outbreaks. In Northumberland County, 16 confirmed cases, 1 probable case, 2 current high-risk contacts, 1 hospitalization, and 15 resolved cases with 2 confirmed outbreaks. May is Better Hearing Month. With many of us wearing masks, those with hearing issues will have a more difficult time communicating. Your TV's Mary Tendichat speaks with Director of Audiology Andreas Salic to discuss the obstacles and solutions.
So a lot of people are in different communication situations in COVID right now. And so one of them, people are at home, and so they're looking to different tools. They're reaching out to, FaceTime and Zoom meetings and things like that, which are fantastic in order to keep people connected. Unfortunately, they can aggravate some of the underlying hearing issues that people have been having. So if people were already having, a little bit of a difficulty, when you add this extra layer of complexity, maybe you're not getting as much acoustic information, maybe the quality of the call isn't as good, maybe the visual cues aren't good because the lighting is poor, or whatever it is, that extra layer of complexity can be the straw that breaks the metaphorical camel's back in terms of communication breakdown. So that's certainly one of the issues. And then the other issue that's been coming up a lot for individuals is mask wearing. So we're seeing a lot of mask wearing for source control, so protecting the individual as well as protecting other people. And the consequence of that is that you're robbing individuals of visual cues. And so we don't realize it, but we're not just hearing with our ears, we're hearing with our brain. And that means that we're not just looking for the sounds that we're hearing, but we're looking for visual cues, be it body language or lip reading. And our brain uses the sum of all of that information in order to understand what's heard. And so with mask wearing, we're taking away a lot of those visual cues. And so again, people that might have been at a disadvantage hearing, we're relying on those visual cues, and you take those away, and that again can make all the difference. So one of the ways we're trying to overcome the issue with losing the visual cues with mask wearing is that we're sourcing masks that have visible pane where the mouth is, and so that's allowing you to preserve some of the visual cues that would have otherwise been lost. And it might not be a perfect solution, but it's a nice compromise in allowing us to keep our staff safe, our patients safe, and still help keep communication the best we can under these circumstances.
Masks are definitely part of our current situation. Going forward, it may be our new reality. If someone would like to obtain a mask that has a clear opening, where would they go about getting that?
So right now, the easiest way to source them is there's a lot of individuals making handmade masks, and that's probably the easiest way for people out in the community to access them. And so whether it's, a local tailor that's, found this as an opportunity to help people out, that's probably the most likely bet, although there are some that are being large scale manufactured. It's just a little bit more difficult for the public to access those.
You also mentioned lighting and how in social media that can be an issue. How are you able to overcome that?
So, with good lighting, we're being conscious of where people are being seated. We want to increase distance, but we also want to keep good lighting on the face. When we're talking to individuals, making sure you're maintaining good eye contact in those kinds of situations, and just being really present and conscious of the communication.
The arts community has been hit hard by the pandemic, and it's this week's focus of Politically Speaking. Host Jay Amer speaks with 2 active members of the local arts community, Jonathan Lockyer of ArtSpace and Rick Fines.
We've certainly seen in our sector that there has been a rush to try and digitize and to move to a online platform, and I think that's fine, and certainly for larger institutions they have the infrastructure and the capacity to do that. For us, I think our biggest concern is that we don't cancel any exhibitions outright, that instead we're postponing into the future. Artists often are working gigs and contracts to pay to be an artist full-time. As we know, most of that work has dried up. A lot of artists we know are relying on CERB to get through the coming months.
When I'm reflecting on your schedule, we've been in this situation for a couple of months. It must take a bit of a readjustment for someone like you. So what would you do when you make a living performing? You have other avenues, I think, that you're involved with, but when things shut down, you're not making travel plans, you're not heading to concerts. What can a musician like yourself do to keep busy, but also continue to make a living?
So this Zoom platform that we're using now I've been giving some guitar lessons that way, and trying to get my workshops together, because I was going to be at two major guitar workshops in British Columbia. And with them canceled, I'm going to see if I can pull off something like that from home. I've done a couple things like that already. So I know for me, for instance, every year for the last 10 years, I would have at least 1 month where I made virtually nothing. And so I had to, put aside something through the rest of the year to get through that month. So I was lucky to be heading into tens of thousands of dollars worth of work over the course of a few months. But that's the way it works. It's like seasonal work. It's like being a landscaper or something. You have to adjust to that. Yeah. So with that gone, you can't replace tens of thousands of dollars with thousands of dollars. You just you keep afloat and enjoy the good parts of it, like the extra time with my kid and putting the garden in and doing the things that you can, because that's what you got, right? And I think in that way we are a lot in the same boat, because everyone's stuck trying to figure out what to do with this time and make the most of it and figure out how to bail out later.
This episode of Politically Speaking premieres tonight at 7 p.m. right here on your TV and will repeat multiple times over the next week. As COVID-19 local impact continues on your TV, an update from Northumberland and the city of Kawartha Lakes. Welcome back to COVID-19 Local Impact. I'm Dan Malta. Last Thursday, the province of Ontario announced we're entering phase 1 of reopening the economy. Included in the announcement, libraries are now able to offer curbside pickup. Cobourg Public Library CEO Tammy Robinson explains to your TV's Mark Rockburn what the curbside pickup process looks like.
What we've done is Friday and Saturday, we started calling people at home that had their holds that have been waiting since, March and April to get their items. And what the process is, it's contactless. So we try to make it as easy for our patrons and our staff as possible. So what will happen is you receive a phone call from us, and then we let you know that you have an item here for pickup. We have certain hours that we're open for pickup. So today, for instance, we're open 1 to 4, and the next day 10 to 1, and then 1 to 4. So we're alternating between afternoon, morning. When the person comes to the library, they do not need to show us their library card. We decided we would check the items out for them already, so they didn't have to go into their wallet, get their card, pass it over, and so on. Everything is checked out. They will need to stand in line on the sidewalk, which is all marked off. We will have a staff member out in the parking lot. I think it's me today. And you simply give me your last name. I let the person know in the library, who will just be in that little area in the lobby. They will then pass that name to a runner who will grab your bag. The books are already bagged in a paper bag. Set it on a table, staff steps back, you take your bag, and away you go. If you're not able to get out of your car for any accessibility issues, again, I will approach the vehicle, ask their last name, I'll get the bag, and I'll put it in their trunk. So it should be relatively quick, since no one's getting money or cards. It's just, what's your name? Here you go, and off you go.
How can people go about reserving books or getting books out of the library? Still the same process, or?
Still the same process. There's the two ways. You can go onto our website and just go into your account and put whatever you want on hold. Or if you do not have technology or unable to hook into it, then you just call, and we will have someone manning the phones, and we will go and grab those books for you. But because we're doing the backlog right now, it'll take us a few days to get through that. So anything that's been placed on hold these past few days, you probably won't get a call till next week until we can get all caught up. There are a couple of things we are not allowing to go out at this point. One is the big giant telescopes. They're not going to be going out. We have what we call, it's a collection called Discovery Backpacks. We decided not to have those go out because in those Discovery Backpacks, not only is there books, but there's also little activity things. So there's one on trains, and so there's little trains and train tracks and little people in there. So we've decided, you know, those items won't go out. And board books. That was a tough decision not to have board books go out, but because kids tend to eat them and chew them more so than read them, we felt it was just safer to remove the board books from this pickup service right now. So, but we have everything else. There's movies, there's video games, there's picture books, and our books, of course. The seed library is operating, but you have to request the seeds you want, and we mail those out to you. So we won't be giving out seeds during the pickup, but there is other ways to get that.
How busy has the library been up to this point?
This has really been a learning curve for us. I must say, there's things we're doing virtual that we never would have dreamt of doing, or we would say, you know, this sounds kind of neat, but I doubt anyone will participate. For instance, our book club, we would have book clubs and we would maybe get, you know, 4, 5, 6 people show up. We have 37 people signed up to our book club and they all participate. I can't believe it. Our weekly challenges, you know, that we have for families and kids, we always have participants. Our genealogy virtual programs, people are doing research now that they're home. And this is another program that's just packed with people. We love it. Our staff are so excited.
For residents in Port Hope, a message posted on the library's Facebook page states the Port Hope Public Library is not ready to swing open the doors on service just yet. The health and safety of staff and the community continue to be the priority right now. The library hopes to soon confirm dates and details for gradual phased-in public service. On April 30th, Cameco Corporation announced a $250,000 COVID-19 relief fund to help the communities of Blind River and Northumberland County. The fund would receive applications from charities and not-for-profit organizations. VP of Cameco's Fuel Service Division Dale Clark tells Mark Rockburn they received more than 72 applications seeking more than $1 million in total funding assistance.
I mean, first of all, we're very committed to our communities, and I'm talking about the Blind River area where we operate a refinery, and here in Northumberland County, we have a few locations. The connection to our communities is very important to us. We have a lot of employees. We work here, live here, play here, and of course, we know that our communities have been suffering. There's a lot of folks in the communities that have very real challenges as a result of the pandemic. We're in a position where we think we can help, and that's what we wanted to do here with this program, is to help make a positive difference in our communities.
What was the criteria for these groups and organizations to be able to submit an application?
So specifically, the fund is meant for any charity or not-for-profit organization in Blind River area that's operating in the Blind River area, or located or doing services here in Northumberland County. And also specifically, the funds are meant to deal with the challenges as a result of COVID-19 as well.
How many groups ended up submitting an application, and how much money was asked for total from those groups?
So we received 72 applications requesting just over $1 million in total. So it's obvious that the demand is very high. There's a lot of people in need. There's a lot of people doing really great work to try and help those people as well. But that application process showed us just how high and how real the need for help is in our communities.
Did that surprise you, Dale, the amount of people and the amount of money asked for?
It did surprise us a little bit. We had some indication. Cameco as an organization did a similar program in Saskatoon and for Saskatchewan area where we're also located. So we had some indication from the application process there that the demand was very, very high. But it is eye-opening just to realize just how significant the demand for help really is in our communities here.
Out of that total, Dale, you're able to narrow it down to 35 groups and organizations. How were you able to narrow it down? And obviously the criteria for that must have been hard to pick one group over another, seeing you had so many groups asking for over $1 million.
Yeah, these were really difficult decisions to make in a lot of ways. I mean, first of all, it's obvious that there really is a lot of wonderful organizations and terrific people that are really working very hard to make a positive difference in our communities. That much is very obvious from this process. But there is a limited amount of funds available. We did have to make some difficult decisions, and so we're looking for ways that we think we can make those dollars have the biggest impact. We're very much trying to look for ways to address some of the urgent needs that we know people have around food and shelter, mental health services, personal protective equipment, for example. There's a broad range, but we're looking for those areas in particular.
So was that what made these 35 stand out above the other ones?
Yeah, in many ways, they address those urgent needs. As I said, those are certainly very difficult decisions, and they're all really impressive people, impressive organizations. But that did, the organizations that we chose, we're very proud to be partnered with and to provide some support. We believe they can really make a big difference in the communities that we operate in.
There weren't any major issues with physical distancing on the trails or the water in Kawartha Lakes over the long weekend. Kawartha Lakes Mayor Andy Letham says the OPP were out in full force, and other than talking to a few groups, people seem to be following recommendations of physical distancing. Bylaw officers in OPP will be continuing to patrol for people not adhering. That's the show for the day. For Your TV, I'm Dan Malta, and we'll see you tomorrow.